में आपका स्वागत है। दोस्तों, वी आर टॉकिंग टुडे ऑन अस्थमा। अस्थमा पेशेंट्स को नॉर्मली ब्रीदिंग डिफिकल्टीज होती है, चेस्ट पेन होता है, कई बार खांसी भी होता है। लेटेस्ट स्टैटिस्टिक्स ये बताते हैं कि इंडिया में करीबन 3% ऑफ द पॉपुलेशन इज अफेक्टेड फ्रॉम अस्थमा। आइए जानते हैं अस्थमा क्यों हो जाता है, कॉजेस क्या है, इसका ट्रीटमेंट क्या है और इसको क्योर कैसे कर सकते हैं। इस टॉपिक पे डिस्कस करने के लिए हमारे साथ जुड़ रहे हैं हमारे गेस्ट डॉक्टर थॉमस कोशी। डॉक्टर थॉमस कोशी एक माने हुए कार्डियोलॉजिस्ट एंड डायबिटोलॉजिस्ट हैं। पिछले कई सालों से मुलुंड में प्रैक्टिस कर रहे हैं। उनका अपना एक हॉस्पिटल है, होली ट्रिनिटी हॉस्पिटल। इसके अलावा हीरानंदानी हॉस्पिटल में भी एज अ कंसल्टेंट डॉक्टर हैं और गवर्नमेंट हॉस्पिटल में भी हेड ऑफ द डिपार्टमेंट है। ये मिलते हैं और बात करते हैं अस्थमा डिजीज के बारे में। Welcome, sir. Welcome to our show, Saral baat. Sir, today our topic of discussion is asthma. So, सबसे पहले मैं यही जानना चाहती हूँ, sir, कि what are the causes and symptoms of asthma?
Madam, the common cause for asthma is idiopathy. That means most of the times we do not exactly know the cause of asthma. Some of the cases can be hereditary. That is, it is passed on from either the father or the mother or some relative in the thing. It is passed on genetically to the child. And some causes of asthma are because of allergy. That is, they are allergic to certain food stuff or some thing which they inhale from outside, like smoke, dust, pollen, many things in the air which can create hyper responsiveness of the airways. And the symptoms, the very, very common symptom that the patient comes is all of a sudden the patient becomes very breathless, and with the breathing difficulty, they have what is called as a wheezing. That means they develop a musical sound when they're breathing in and out. Sometimes patient comes and says ekdam sui 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 jaisa awaaz aata hai. Sometimes it is very, very severe that they have to be even hospitalized for treating them. Some of the patients develop what is called as a cough. So they have dry irritating cough, and sometimes there is there's no breathing difficulty with it. That is called as a cough asthma. It's a variant of an asthma that is. So these are the common symptoms that we see with.
Is asthma completely curable?
Madam, asthma is a hyperreactive airway disease. So what happens is, if there is something which is inciting or triggering this attack, then that trigger factors you have to prevent. So if you prevent, you can prevent most of these attacks. But once the trigger starts, then the asthmatic attack is inevitable. And then they will have to see a doctor to get the proper medications and to see that, that the asthma episode is coming down. And a good treatment and good control is as good as cure.
Then what should be the line of treatment for such patients?
The patient should understand that what are the factors which are triggering this. So like I told you, if it is some fumes or is some chemicals or some dust or this thing, they have to try to avoid those particular things. And sometimes what happens, even foodstuffs also can create allergy. There are people who are allergic to various foodstuffs. Sometimes it might be, like very commonly used fruits, vegetables, or eggs, or nuts, some of these things. So once they identify that, they have to see that these particular foodstuffs have to be avoided.
अगर किसी को अस्थमा है, तो क्या उसका लाइफ स्पैन कम हो जाता है?
नहीं मैडम, if they are properly treated and properly this thing, their lifespan is whatever is the natural lifespan that God has given to them, that much will be their lifespan. But if it is not properly treated and uncontrolled, and what happens, it becomes into a chronic problem, then what happens is progressively the lungs will get damaged and destroyed. They can go into complications and maybe die of some of the complications. Otherwise, the normal people, if they properly take a precaution, then the lifespan is good.
Thank you so much, sir. Thank you for sharing your important time with us. दोस्तों, हम इसी तरीके से नई इंफॉर्मेशन आपके साथ शेयर करते रहेंगे। आप हमसे जुड़े रहिएगा। हम फिर मिलते हैं। थैंक यू।